with corneal clouding and facial features, including shorter dwarfism. So the moment I read the question, I know that I'm dealing with mucopolysaccharidosis. And then he has mentioned a couple of skeletal profile of this patient as well, kyphus, scoliosis, pectus carinatum, hypermobile joints as well. So yes, guys, can I have the answer for this one? What would be the main pickup point in this question? You see, the main aspect for this particular question is the orthopedic manifestations that is given. So though from corneal clouding, it looks like Hurler syndrome, but you can see that the intelligence is given to be normal. Normally, whenever we are dealing with any format of mucopolysaccharide that is Hurler syndrome, there would always be some kind of IQ will be low, or there would be like mental retardation as a description that would be given. But in this case, like the mind is normal. It is the skeletal abnormalities that are present. I repeat that statement. Mind is normal and it is the skeletal abnormalities that are given. In the light of that information, mild normal and skeletal abnormalities, this would be Morque's syndrome. And in Morque's syndrome, you can also comment in the chat box with respect to what is the enzyme that would be affected. For Hunter syndrome, I just want to say that the enzyme is iduronate. If you have any other mnemonic, then it is okay. But Hunter जो है वो मतलब animal को kill करके फिर खा रहा है तो 8, because in Hurler it is iduronidase. Ace word is coming up here. It is iduronate. So because of that vocabulary, sometimes error can be present. So I hope that Hunter is eating or 8 can help you in remembering. And galactose-6 phosphatase for the question that I've answered. The answer to question number 18th is option number C. Moving to 19th one, this is a child who's born to mother with poorly controlled phenylketonuria during pregnancy, and then the child is having microcephaly, growth retardation, heart disease as well. If I say anything more, the answer becomes obvious. So let's have it from your side, like which is the finding that would be present in this particular case. And more than one answer can be correct. Obviously, like maternal phenylketonuria is what is being talked about. The baby is normal. The baby has not acquired the disease from the mother, because the question is mentioning that the baby is perfectly normal in this question. Therefore, like the baby is perfectly normal. That is why mousy odor of urine will not be present. But the remaining things will be there, like, child will have intellectual disability that is given in the stem of the question, growth retardation. And the only thing that you have to pick up was the heart disease, that is tetralogy Folate. So answer to question number 19th is option number B. Yep. The main point is because it is written genetic testing is normal. That is why the answer to this question would not be 1, 2, 3, 4. And if the baby had acquired, because autosomal recessive condition hai, to there is like approximately 25% chances that disorder autosomal recessive on chromosome 12 can be transmitted to the next generation as well. So we sorted for 19th one. We come to 20. Yes, Nikki, you were right for that one. That the baby is normal. That's why like mousy urine is ruled out. Okay, so we have this boy, he's coming with the low backache, pain in the knees with a bluish black pigmentation over the ear and the cartilage, clear in the cartilage. So we know that we're dealing with Alkaptonuria, because he has himself mentioned that in this case, urine turns black after standing for a few hours. In homogentisic acid oxidase, like the question says, what is the enzyme that would be involved? So Alkaptonuria usually has aortic valve involvement. It's usually in the form of aortic stenosis in a patient. Homogentisic acid is the one that is involved. Then is ochronosis that is present, and Alkaptonuria begins with A. So the heart valve that is involved here also begins with A. Valvular aortic stenosis is the one that we usually see. So answer to 20 is delta. The next question is about arachnodactyly with intellectual disability. So we have to think either about Marfan syndrome, or the second possibility can be homocystinuria. He has himself mentioned the word urine cyanide nitroprusside test that helps you identify that he's talking about homocystinuria. And the problem with homocystinuria is that there is increased incidence of heart attack or increased incidence of coronary artery disease. Thromboembolic episodes in this patient would be increased. So answer to 21 is option number C. The reason being that homocysteine per se is a prothrombotic, homocystinemia per se is a prothrombotic condition. Next is a patient who started using an Apple Watch and noticed that her heart rate was increasing from 80 to 130 on suddenly standing and doing brisk walking. Then he's mentioned like the ECG of the patient, and then has gone to say that there is a past history of prolonged recovery following a severe illness. So ECG of this patient, in fact, I should have shown, but is normal. Maybe that did not come up in the print out here. The ECG of the patient is normal. Postural orthostatic tachycardia syndrome. नहीं उसमें तो फिर orthostatic होगा ना, BP fall कर जाएगा ना. Like this is not POTS, because POTS में क्या होगा, they would be syncopal episodes. What does POTS result in? POTS results in development of syncopal episodes. And orthostatic word लिखा है, so orthostatic episodes would mean that they would be fall in the blood pressure of the patient also. लेकिन यहाँ पे तो as such the only thing that is happening is there is an increase in the heart rate of the patient, that is due to deconditioning. If a person is like not doing exercise, लाइक आप और मैं भी जैसे अभी तो मतलब हम सारे ही डॉक्टर्स जो होते हैं वो मोस्टली काम करते रहते हैं, डेस्क जॉब करते हैं, तो हम थोड़ा भी एक्सरसाइज करते हैं हमारा हार्ट रेट एकदम से बढ़ जाता है, बिकॉज हमारा हार्ट श्रिंक कर जाता है, तो कार्डियक आउटपुट लेस होता है. तो टू अचीव द सेम लेवल ऑफ आई मीन इफ यू डू एक्सरसाइज देन ऑब्वियसली यू नीड सफिशिएंट अमाउंट ऑफ ब्लड फ्लो, सो आवर हार्ट विल हैव टू बीट फास्टर. सो द आंसर टू दिस क्वेश्चन इज ऑप्शन नंबर बी, that is inappropriate sinus tachycardia, that is deconditioning इसको बोलते हैं. It's a physiology based question that we call it deconditioning. Deconditioning means that we are not doing exercise, so our heart muscles will tend to, cavity size will become smaller, endostolic volume will be smaller, stroke volume will also be lesser. So answer to 22 is option number B. Orthostatic hypotension के लिए तो फिर mention होना चाहिए ना, syncopal episodes should be there, and then the question should also mention regarding like maybe a recurrent episodes the fall. It is only a tachycardia that is present here, which is why the answer to question number 22 is Bombay. So some questions will be like this only, that you will have to struggle for them, but it's okay. Coming to 23, which of the following is correct about Oedipism? Yes guys, quick answers please for question number 23. Yes, I'm waiting. You can also mention the number of the question prior to that also, because then it becomes relatively easier for me to like comprehend whatever you guys are saying. Okay, so answer is option number, yeah, it is self-harm behavior. This is not Oedipus complex. Now that Oedipus complex would be like erotic fun. That is Oedipus complex, right? That is totally a different thing. Question is not on Oedipus complex. The question is on the topic of Oedipism. Oedipism means self-mutilation. We also called it Van Gogh syndrome. This would be like common in patients with schizophrenia, where these patients will try to maybe hurt their own self. तो क्या करेगा कि वो एक sharp सा object लेके अपनी eyeball को hurt करने की कोशिश करेगा. He might try to attempt a enucleation there. So self mutilation findings can be seen. Usually we read about self mutilation with Lesch-Nyhan and then with schizophrenia. So self harm behavior is what is called as Oedipism, and not to be mixed up with the Oedipus complex. So 23rd is sorted. We come to 24th. The mother has come with a 2-year-old boy. He's born at 38 weeks, and their diapers are having that orange staining and stand like crystals. And he's asking about the inborn error of metabolism. Homocystinuria, is about tyrosine, right? Tyrosine metabolism. Yeah, tyrosine will always be causing the rotten eggs appearance, the rotten egg smell or bad sulfide smell that would be coming up. So that obviously that sulfide smell in the urine would be present, or like rotten eggs smell is present. So that is easy to rule out. Orange sand, because it is written it is crystals of uric acid. Because it is orange sand, therefore it is crystals of uric acid, and that uric acid elevation is what we get with respect to Lesch-Nyhan syndrome. So answer to 24 is option number A, that is Lesch-Nyhan HGPRT deficiency, and then there is hypoxanthine phosphoribosyl transferase deficiency, and uric acid levels are elevated, which can explain the self-mutilative behavior. 24th is A. We come to 25. The child is having a defect in the transporter responsible for absorption of tryptophan in the intestine, and he says which of the following will not be seen in this particular condition. Waiting for your answers for this one. Tryptophan के साथ में, yup, tryptophan plays a role with respect to niacin synthesis. So if tryptophan will not be absorbed, then niacin levels will be lesser. So that is understandably present. But neutral amino aciduria लिखा हुआ, तो neutral amino acids will not cause formation of any kidney stones. Na? Like in cystinuria, like there is like cystine present. So like cystinuria, there is a change in the pH, but for tryptophan, which is a neutral amino acid, there is no change in the pH. So there is no crystallization that would be present, and therefore the answer to this question is option number C. And yes, the clinical diagnosis, I was waiting for that comment to pop up. That would be called as Hartnup disease, because tryptophan is the one that is being talked about at the moment. Answer to question number 25 is option number C. Renal stones not seen in Hartnup. That's because it is the neutral amino acid urea that would be present. So 25th is done. We come to 26. This kid is having progressive neurodegeneration with the exaggerated startle response with developmental regression, cherry red spot present. So neurodegeneration in cellular spot will always be Tay-Sachs disease, but the twist in the question is only that there is a hepatosplenomegaly. If there is a hepatosplenomegaly and also vacuolated lymphocytes, even if you miss that out, main thing is organomegaly. If these words were not given, then the answer would have been Tay-Sachs, because in this question hepatosplenomegaly is given, vacuolated lymphocytes are given. That is why the answer is Sandhoff's disease. Yes, Imran Gautam, you were spot on for this one. Answer to 26 is option number C. Coming to 27, xanthomas in the tendons. You can see Achilles tendon में xanthomas है. This is a characteristic feature of familial hypercholesterolemia. What is familial hypercholesterolemia? It's autosomal dominant condition type 2A, and therefore the answer to question number 27 is Bombay. That is type 2. Is the Fredrickson classification is always asked. That's one topic that is always to be read before the exam as far as the type location of the xanthomas are concerned, and especially if they say tuberous or tubero-eruptive, then it is gonna be like tuberous is type 3, eruptive is gonna be like triglycerides with 1, 4 and 5. So do remember those numbers also that I just highlighted. And apart from that, obviously that one that I showed you, the tendon xanthoma, would be type 2 hyperlipoproteinemia. Coming to 28th, Figlu test is being done. You know, Figlu test is basically for folic acid deficiency, vitamin B9 deficiency. Now he says what is the core biological function of the vitamin that is being tested. So B9 is always known to be a 1 carbon carrier. So this is okay. But then, yes, I'll wait for the remaining options for this one. It is a 1 carbon carrier and it plays a role with respect to formation of DNA ना. उसको DNA बनाने के लिए चाहिए और DNA को बनाने के लिए then thymidylate is also required. I mean, for the formation of thymidylate, we need folic acid. It's a one carbon carrier. So 1 and 4 are the correct. It's not a 2 nitrogen carrier. So that's ruled out. And it is not playing a role with respect to histidine synthesis. So 1 and 4 are correct, which is why the answer to 28 is option number C. Coming to 29th, alcoholic is diagnosed with pyogenic meningitis, is started on antibiotic treatment, and then there is a tumbling motility that is present. So the organism that is present here is Listeria. Now the characteristics of Listeria monocytogenes are that it grows on Pelcum media, that is chromogenic media, so that is okay. Gram-positive organism also can be seen with consumption of sandwiches, chicken, etc. But then the data C is inverted. It is non-motile at 25 degree and it is motile at 37 degree. Actually में उल्टा होता है. तो how you remember this is, you can imagine Listeria, it is like doing ice skating. तो बर्फ पे तो ठीक है, जैसे गर्मियों में बर्फ पिघल गई तो गिर गया तो non-motile हो गया. So it is like a easy way to remember this. The answer to question number 29th is option number C. Non-motile at 25 and motile at 37. उल्टा होता है. It is like it is motile at 25 and it is non-motile at 37, and this small infographic can be used to remember this. Okay, which of the following is not seen with Campylobacter jejuni? So this is a bacteria that is well known to cause Guillain-Barré syndrome. That is okay. It is also known to cause reactive arthritis, and it can also contribute to development of immunoproliferative small intestinal disease. Yes, but EATCL, you see, EATL, enteropathy associated T cell lymphoma, is what you see with respect to celiac sprue. It is one of the causes of death. And what is immunoproliferative small intestinal disease? It is maltoma. Instead of writing this, he can also write the word maltoma. Traditionally, we read about maltoma with H. pylori, but today I'm telling you maltoma even with Campylobacter jejuni. Normally, we read maltoma with H. pylori. Today, I'm saying maltoma with Campylobacter jejuni, and then EATL is seen with celiac sprue. So, answer to question number 30 is option number D. Then scrub typhus is what they love to ask farmer, and then there is a lesion on the arm and on the axillary area. So like if you look at like the S chart, that's like very characteristic. Wheel-Felix reaction is being done, and he says that Wheel-Felix reaction will be positive for which of the following antigens. So like the hack what I've said earlier also is scrub typhus को लिखने की जगह पे spelling change कर सकते हैं. Like instead of writing the word SCRUB, you can write the word SKRUB. That helps you remember OXK positivity. The correct answer for this is option number D only. As far as the remaining ones are concerned, OX19, that is for epidemic and endemic typhus. That OX19 part, no, that's for epidemic and endemic typhus. But for like Rickettsia susukamusi, that is scrub typhus, the K alphabet comes in. Therefore, the answer to 31 is delta. Which of the following is the largest hepatotrophic viruses? Yes, guys, a petty fact only, but yes, quick answers, please. Largest hepatotrophic virus, please. Yeah, I think I've already explained to you this. It is not the B virus, it is the C virus. Dane particle जो होता है वो 42 नैनोमीटर का होता है. मैंने बताया वही आपको द डेन पार्टिकल जो होता है वो 42 नैनोमीटर का होता है. दिस वुड बी 55 नैनोमीटर. सो द लार्जेस्ट हेपेटोट्रोफिक वायरस इज हेपेटाइटिस सी वायरस. Answer to 32 is option number C. We come to 33. A kid with febrile neutropenia is admitted to intensive care unit with a yeast sepsis. Now the organism grows best at 42 and is Reynolds brood phenomenon negative. That's a peculiarity, because if you are talking about febrile neutropenia, then fungal sepsis makes sense. Because if he's talking about chromagar, if he's talking about Reynolds brood, that means he's talking about something related to Candida only. The peculiarity is that the Candida in the patient is turning out to be negative. So we're talking about a superbug, guys. Most of the time, this will be multi-drug resistant. And even if you use micafungin, echinofungin, it would be like too difficult to treat. You'd be aware like one vial of micafungin would be costing up to 20,000 rupees. And maybe like 1 week treatment can go up to 10 lakh rupees also. So fungal sepsis is a crazy thing, and still the patient dies. So lots of time the relatives will fight that sir इतना खर्चा करा दिया antibiotics का. And most of the time these pharma companies ना what they do is कि वो बोलते हैं hospital में एक ही जगह से मिलेगा. Scam they do is they'll say that only this shop is having this medicine and there is no discount available also. So like Candida auris is like a big problem because of multi-drug resistance. The answer to this is option number D. If it said Reynolds brood phenomenon positive, then I know it is Candida albicans that I'm talking about. Tropicalis तो यार मतलब skin पे present हो सकता है ना. It is Candida auris जो कि ICU करता है. I'm basically talking about what I am talking about at the moment is yeah, auris is having aura about it. Variable color is also present in the chromagar. But then this is one of the leading reasons of why like a central line associated bloodstream infection will occur, but obviously not from the perspective of like any bacteria. It is fungal infection that would be coming in the patient. 35, he says, which of the following is the cause of diarrhea in a HIV positive patient? They always love to give this acid fast stain that is called as a Kinwan stain, and they'll ask you like what is the organism. So you can see two big dots present. So usually they give the size also. So I'll tell you the size criteria also. But at the moment, considering that in the inset you can see two big cysts, which are present. So that would be cystoisospora, which is one of the largest ones. And the treatment for this would be cotrimoxazole, just in case if they want to ask in this question. 34, 35. Okay. 34 is sorted. 35 is like which of the following is correct. Yeah, it's perfectly okay for 35. It is like the stool report is shown, so that would be a cystoisospora if you see two of the cysts that are present. So 35 is yeah, I'll tell you the size criteria, no? One at the moment I want to say that nowadays we don't use the word isospora, no? We use the word cystoisospora. One is we don't use the word isospora, we use the word cystoisospora. And second is the criteria for the size only, ना. One सबसे छोटा तो माइक्रोस्पोरिडियम है, वो तो खत्म ही होगी बात, है ना. उसके बाद में जो होता है वो होता है क्रिप्टोस्पोरिडियम, फॉर विच द एंटीबायोटिक दैट वी यूज इज nitazoxanide. And then you're left with cyclospora and cystoisospora, because nowadays isospora as a word is used, and isospora as a word is not used. It is cystoisospora as a word that is used, along with the two sporozoites that I had mentioned. Longish name cystoisospora versus cyclospora, like more alphabets present, so it's almost double the size, almost like 25 to 30 mics that is present. So if you look at the size criteria which are present for 34, which of the following is a cause? Okay. 34. Okay. Which of the following is not correct about the parasite? Okay. Okay, got it. Which of the following is not correct about the parasite? So 3 would be the wrong statement there. Get your point. I get your point for 34. Yes. The point taken for 34. For 35, the answer is option number A, that is cystoisospora, considering the size here. And isospora, as I said, like the term is not used anymore. So 35 is A, based on the size criteria. We come to 36. We have this 30-year-old man presenting with marked psychomotor agitation and myoclonic jerks. Then he died, like, he aspirated water and he died in the hospital, and the family wants to know what is the cause. So they gave a permission for doing a brain biopsy, and you can see the spongiform appearance of the brain. The moment you see the spongiform appearance of the brain, like all these vacuolated appearance, vacuoles everywhere, you know that you're dealing with prion disease. That would be variant Creutzfeldt-Jakob disease. And then it's like you just from there you can take on the point like that I mean direct fluorescence on corneal impression smear will be for rabies, which is not the case here. I mean there's no mention of any hydrophobia for this person. So what is the main diagnostic criteria for VCGD? One, in the CSF of the patient there would be protein 14.3.3. And second is in the cytoplasm of the neurons as well as in the lymph nodes, because security system is in the brain also, security system is in the lymph nodes also. Both will get infected with the prion particle. So PRP-SC is a misfolded protein found in the lymph nodes of the patient as well. Lateral flow assay on CSF is the test that we do for cryptococcal meningitis. So two options are correct here. That would be 3 and 4. Therefore, the answer to question number 36 is option number D. Let me check the reflexes responses of you guys. Okay, so it's taking a while to load up. So 36 is delta, guys. I think I gave logical explanation for the same. Still did not come. Okay, moving to 37. Which of the following presentation is, yeah, 36D. Yeah. Okay. Which of the following presentation is most likely based on the histopathology report of this total thyroidectomy patient? So you can see that bada eyes wala appearance present here, but obviously that eyes is not that orphan ani nucleus appearance present, because orphan ani nucleus will not be having anything in the center. It would be just vacant here. But here you can notice that very classical appearance that is of Hursley cell tumor. The answer to this question is option number D. Hursley cell tumor is a variant related to follicular carcinoma. It will be showing a capsular invasion and then will be showing a hematogenous dissemination. So answer to 37 is D, based on like this is not a papillary cancer. Obviously you did the right job in being able to identify that. Medullary carcinothyroid will always have amyloid deposition, but as far as Hursley cell is concerned, there would be like, you know, that big cytoplasm present, and then like packed mitochondria. I mean, the cytoplasm is dark pink, and then you can see a nucleus with a dot in the middle that helps you identify that this would be oncocytic cells. Oncocytic means basically mitochondria rich cells present, and that explains the aggressive metastasis and the aggressive growth of this tumor as well. Answer to 37 is D. We come to 38. This particular girl, she had weight loss, shortness of breath, and exercise intolerance, and then she had a right atrial mass. So we're talking about a tumor in the heart, pretty easy to identify. Obviously, this is not a rheumatic fever case. And yeah, pulsatile bony metastasis can be present. Now in this particular patient, the point is myxoma is usually more common on the left hand side, and myxoma will be having lot of connected tissue. Here what you are having is that big huge blood vessels that can be seen. So it has to be a highly vascular tumor, which is common on the right hand side. And the hint in the question is the death of the patient due to a bloody pericardial effusion. That is the reason why, like in this particular case, because the pericardial effusion part is given, that is why the answer to this given question is given as angiosarcoma. Yes, angiosarcoma will be one of the common, like, you know, just give me a second. Angiosarcoma is like the most common malignant cardiac tumor when it comes to adult population. If I talk about children, then it is okay, rhabdomyoma, which is associated with tuberous sclerosis, but not like like this is teenager going into an adult. So, and we'll have to go by histology and the location part also. So answer is angiosarcoma. Okay. And yeah, spider cells would be present with respect to patients who are having present, like, you know, there would be two slides that would be coming to you. One is for rhabdomyoma. If you are having these spindle cells present, then spindle cells would be rhabdomyoma. And if you're having the spider cells, like if you look at these projections like these, you know, cytokeratin or like the actin filaments, which can cause that spider appearance present, then I'll say that I mean, rhabdomyoma is more common with tuberous sclerosis, so he can give genetic basis for the same. But if he starts talking about spider cells, then obviously the whole perspective would change. And then angiosarcoma will be having vascularity. The biggest reason why, like, I think that even without the slide, one can crack the question is the bloody pericardial effusion component that was given in the question. Next is salt and pepper chromatin. A very famous slide. Salt and pepper chromatin is a feature that is seen with the carcinoid tumor. And now the question is like, what are the manifestations that would be seen? Because it's a tumor in the lungs only. It's like a tumor originating in the bronchus. And then he says like, which of the following would be correct for this kind of presentation? So yeah, it can produce Cushing syndrome, right? That is why like we ectopic ACTH production. So that purple striae and hypokalemic alkalosis makes sense. Platypnea and weight loss is something that we'll be seeing with the atrial myxoma. So I rule that out. Yes, guys, waiting for your answers for this one. When it comes to flushing episodes and diarrhea, it is only seen with GI mets of carcinoid tumor. Like suppose if a patient is having carcinoid in the ileum or in the rectum and it metastasized to the liver, then it will escape the first pass metabolism and thereby flushing episodes can be seen. Bronchus wala banayega to it will go in the blood. From blood it will go over the heart via the blood to the liver. It will get metabolized. I'll say that again. जो bronchus वाला carcinoid होता है वो flushing नहीं करता. वाई द ब्रोंकस वाला कार्सिनोइड फ्लशिंग नहीं करता इज बिकॉज वो जो भी बनाएगा वो सारी चीज़ें तो लिवर उसको फर्स्ट पास मेटाबॉलिज्म में खत्म कर देगा तो फ्लशिंग हो ही नहीं पाएगा. बट बिकॉज ऑफ द लोकल ग्रोथ ऑफ द ट्यूमर दे कैन बी रिकरेंट एपिसोड्स ऑफ हेमोप्टिसिस विद कफ एंड वीजिंग. सो वन इज एन ओके स्टेटमेंट because of the local growth, and purple strian hypokalemic alkalosis also, because of which the answer to this question will be option number 2. The main point I wanted to bring to your attention was that GI mets of carcinoid will escape the first pass metabolism and thereby flushing can be seen, but bronchus wala will straight away send it directly to the liver and the 5-HT derivatives will get metabolized or they'll get degenerated and therefore the manifestations will not occur. Coming to 40, we have a patient with headache and visual disturbances. Age of the patient is important for this one because visual disturbances are given and you can see a mass with respect to the pituitary. So the first thought process is it could be a pituitary adenoma, but then though hormonal manifestations are given, so I am suspecting it could be craniopharyngioma. But then craniopharyngioma will always be having like wet keratin. Here if you look at it, there is no wet keratin that is given. It's only epithelium that is distributed. So this is a differential that is to be remembered. That would be Rathke cleft cyst. The answer to this question is based on this slide that is given. If I change, if I give you a slide in which keratin pearls can be present, like the one that you can see at the moment, then I'll change it over to craniopharyngioma, considering a pituitary mass which is present. But in this particular case, like the appearance of squamous epithelium is not there. It's rather more of cuboidal or like a columnar epithelium that is present. No keratin pearls, which is why the answer changes over to Rathke's cleft cyst. Answer to 40 is option number C. Okay, coming to 41. A patient is presented with 40. Yeah. Okay. Okay, so 40 is B versus C. Okay, so answer is C. Coming to 41. This is a patient who is coming with chest pain and diaphoresis. He has been previously hospitalized for cardiovascular complaints and he has died because of he died during the second day of treatment. Postmortem specimen is shown and there was a LV aneurysm also. If you look at this diagrammatic representation, तो यहाँ पे न्यूक्लियस जो है वो मायोसाइट के अंदर तो है ही नहीं ना. दिस इज कोएगुलेटिव नेक्रोसिस इन द मायोसाइट्स. जितने भी न्यूक्लियस है सब बाहर प्रेजेंट है. इट्स लाइक अ इन्फिल्ट्रेशन. नो मैक्रोफेजेस वुड बी कमिंग इन, न्यूट्रोफिल्स विल बी कमिंग इन टू ईट टू डैमेज द कोएगुलेटिव नेक्रोसिस वाले मायोसाइट्स. जो एरिथमोजेनिक राइट वेंट्रिकुलर डिस्प्लेजिया होता है उसमें तो फैट होना चाहिए ना. तो इसका क्वेश्चन का आंसर ए तो हो नहीं सकता बिकॉज ARVD शुड बी ऑलवेज हैविंग प्रेजेंस ऑफ फैट एंड अलॉन्ग विद दैट देयर शुड बी प्रेजेंस ऑफ फाइब्रोसिस. फैट इज नॉट विजिबल. फाइब्रोसिस के लिए तो क्या स्पेशल स्टेन लगाएंगे. Charcot-Marie-Tooth cardiomyopathy will have a history of like emotional trauma not given in this question. For viral myocarditis, which is a close answer, there would be features of heart failure that are occurring in a patient. But उसने खुद ही बोला है कि इसको पहले भी hospitalization हुई है. Previous medical history is also given. LV aneurysm is also given. That is a complication of myocardial infarction only. Na? What has happened in this patient is ischemic heart disease. The answer to question number 41 is delta. The rationale behind ischemic heart disease is that if you look at it, तो यहाँ पे myocyte के अंदर तो कुछ है ही नहीं, वो तो खाली है. So I can say there is a hyper-eosinophilic myocardium. I mean point number 1 for this slide is that this is undergoing, इसको ghost cell बोल सकते हैं ना, like जब coagulative necrosis पढ़ते हैं तो उसमें ghost cells होते हैं. So hyper-eosinophilic myocardium is present. What you are seeing outside in the form of blue is the neutrophils that are coming to eat, because usually by second or third day after MIE, it is like the neutrophils that would come, and then maybe later around the 5th or the 7th day, it is the macrophages that would be coming. So the answer to this question is option number delta. For ARVD, there will always be family history. For ARVD, ECG evidence will be there, or there would be fat or fibrosis described in the right ventricular epicardium. Answer to 41 is sorted. We come to 42. This woman came with progressive muscle weakness that is involving the lower limbs, dry mouth and cough for past 3 months. And then he has mentioned CT test showing a lung mass and a guided biopsy report is pending. Okay. Nerve conduction shows a decremental response. So that's a very good pickup point on the question. Decremental response on low frequency stimulation is given. The manifestations are a woman with weight with progressive muscle weakness. So considering that there is presence of muscle weakness, there are a couple of autonomic symptoms, there's a lung mass also, I'm assuming that there could be a paraneoplastic manifestation. You see, if I say that the patient is having a lung mass और लंग मास के साथ में ऑटोनॉमिक फीचर भी दे दिए, मसल वीकनेस भी दे दिया, तो कोई ना कोई पैरानियोप्लास्टिक मैनिफेस्टेशन होगा. कॉमन जो पैरानियोप्लास्टिक मैनिफेस्टेशन होती है वो तो लैम्बर्ट ईटन सिंड्रोम होती है. तो लैम्बर्ट ईटन सिंड्रोम में हमेशा हम पढ़ते हैं कि देर इज लाइक अ इंक्रीमेंटल रिस्पॉन्स ऑन हाई फ्रिक्वेंसी स्टिमुलेशन एंड देर इज अ डेक्रीमेंटल रिस्पॉन्स ऑन लो फ्रिक्वेंसी स्टिमुलेशन. आपको इस क्वेश्चन को सॉल्व करते हुए इस बात का ध्यान रखना है कि देर इज अ मेंशन ऑफ द वर्ड डेक्रीमेंटल रिस्पॉन्स, बट वो कब दिया हुआ है? ऑन लो फ्रिक्वेंसी स्टिमुलेशन. जब मैं फ्रिक्वेंसी स्टिमुलेशन बढ़ा दूंगा तो ये इंक्रीमेंटल में कन्वर्ट हो जाएगा. सो द डायग्नोसिस इज लैम्बर्ट-ईटन सिंड्रोम. नाउ यू कैन फिगर आउट द आंसर रिलेटिवली बेटर. इन लैम्बर्ट-ईटन सिंड्रोम इट इज द एंटी p/q antibodies which are responsible. So answer to question number 42 is option number B, auto antibodies against presynaptic p/q antibodies that are against the voltage gated calcium channels. They will cause a pre-junctional defect. The amount of acetylcholine release will be lesser, and then with high frequency stimulation more acetylcholine will be released, and therefore symptomatic improvement in the condition of the patient can be seen. 42 is Bombay. We come to 40. The key word was decremental response on low frequency. That's the word that had to be picked up, along with lung mass and then multiple symptoms, paraneoplastic. Okay, patient underwent lung surgery. This question, I think you would have just grabbed the opportunity because this is adenocarcinoma of the lung. You can see the glandular appearance of the lung tissue, and adenocarcinoma is always NAPCINA positive and TTF1 positive and P40 negative. P40 positivity is mainly for squamous cell cancer. So the answer to question number 43 is option number A. The diagnosis of this patient on the basis of the slide is adenocarcinoma. The glandular appearance, that is why we had to pick up adenocarcinoma. Yep. 43 sorted. We come to 44. This is a patient with ptosis who's having a diurnal variation. So we're thinking in terms of myasthenia gravis. There's a lobulated chest mass pressing on the rectolaryngeal nerve. So the tumor is increasing in size, so it has to be a thymoma. And then you can see a lot of trabeculations which can be seen in the middle, and then there would be germinal follicles which are present in this particular case. And then he says which of the following is correct. So thymoma is not actually a tumor of the thymus, it is a tumor of the epithelium, and epithelium would mean cytokeratin positivity. Answer to 44 is option number A, because thymoma is not a tumor of the thymus tissue. It is an epithelial cell tumor. Because it is an epithelial cell tumor, that is why CK positivity or cytokeratin positivity would be present. All other options that are given, like leukocyte common antigen, that is for lymphoma, like CD45 positivity, that is what you see with lymphoma. Flap positivity, that is usually seen with seminoma. And then I'm left with CD5 and CD117, but then I had to pick up CK positivity because this is a epithelial tumor. That's why the answer to 44 is option number A. The next question is about increased immunoglobulin E levels with eosinophilia. So anytime you have a child with recurrent infections and then you have increased immunoglobulin E levels, the disease to be thought of as Job syndrome. In Job syndrome, there's a defective recruitment of neutrophils. They are not able to kill the bacteria. That is why you have cold abscesses present. Normally, like Staph aureus abscess would be like a warm and a hot abscess. So Th17 mediated recruitment means that the neutrophil recruitment in this condition is severely compromised. This condition will be having a Th2 dominance. Because of Th2 dominance, that is why you would be having extra production of interleukin 4, interleukin 5, and that's why immunoglobulin E levels would be elevated. So it's not a Th1 dominance, it is the Th2 dominance. Then these children will have double row of teeth. That is like the dentition part, like जो primary dentition के दांत होते हैं वो गिर जाते हैं, फिर जो secondary dentition के दांत आते हैं, यहाँ पे both there would be 2 rows of teeth that are present. So 1 and 3 make sense, and the chromosome that is involved in this case is 17 for STAT3 gene. It is not chromosome number 3. So considering the 2 options are correct here, 1 and 3, the answer to question number 45 is option number B. Yeps. We come to 46. This is a diagram on, this is called as Davenport diagram. 46 is what is called as Davenport diagram. In Davenport diagram, we have to pick up regarding the changes. So if I zoom in, I can just solve by a simple logic. Like there is an acidosis component that is present. So step one is if I move towards the left, there is an acidosis. Now in any acidosis case, you will notice that carbon dioxide values are like very, very high. Like, you know, CO2 values are high, and therefore bicarbonate. If you just look at this now, if I just give you a random cutoff like this, then you can see that the PCO2 the patient is hitting like almost like 80, 90, like outrageously high. Bicarbonate is 44, so it has to be a chronic respiratory acidosis. The answer to question number 46 is option number B. Why am I saying the word chronic is because of super high elevated bicarbonate, super high elevated on the y-axis. ये यहाँ पे कार्बन डाइऑक्साइड होता है, इधर तो चल रहा है वो CO2 चल रहा है, इधर बाइकार्बोनेट चल रहा है, कॉम्पेंसेशन तो चल रही है. But what I'm saying is super high elevated would mean that the values of like the values, अगर आप नीचे जाते हो यहाँ पे जैसे ना, तो I mean the values are still a little more decent. But here the outrageously high values are given. So this would go in favor of chronic respiratory acidosis in a patient, the arm that I've currently shown before you. So answer to 48 is option number B. I'll just wait for your responses for this one. अदरवाइज इसको डायग्राम को थोड़ा मेंटली ओरिएंट करना है. पहले तो इतना तो क्लैरिटी है ही है कि एसिडोसिस है या अल्कोलोसिस है, तो वो तो कोई दिक्कत ही नहीं है. उसके जैसे फैन बनाते हैं तो फैन बना के तीन आर्म्स को आपने स्टडी करना होता है. तो सबसे ऊपर जो है क्रॉनिक रेस्पिरेटरी और एक्यूट रेस्पिरेटरी एसिडोसिस है ना. या मतलब अगर आपको नीचे से ऊपर जाना है तो क्लॉकवाइज चले जाओ. जैसे मेटाबॉलिक एसिडोसिस तो हो ही गया, नीचे से अगर वो मार्किंग करता है तो यू हैव टू रिमेंबर मेटाबॉलिक एसिडोसिस, एक्यूट रेस्पिरेटरी एसिडोसिस, और उसके बाद में देयर वुड बी क्रॉनिक रेस्पिरेटरी एसिडोसिस. फिर आगे चलते हैं तो यहाँ पे इसका ऑपोजिट हो गया, मेटाबॉलिक एसिडोसिस का उल्टा मेटाबॉलिक अल्कोलोसिस. और जब नीचे आओगे तो फिर से पहला वर्ड कौन सा आएगा, एक्यूट, और उसके बाद कौन सा आएगा, क्रॉनिक वाला. हमेशा याद कर लो, पहले तो मेटाबॉलिक एसिडोसिस और अल्कोलोसिस का पोजीशन याद कर लो इन द फैन दैट इज करंटली शोन. उसके बाद में 15 सेकेंड इंटरप्रिटेशन है. फर्स्ट एक्यूट वर्ड आता है क्रॉनिक इफ यू गो इन अ क्लॉकवाइज फैशन इन अ पेशेंट. एंड एसिडोसिस और अल्कोलोसिस तो पीएच से कर लोगे ना यार. पीएच यहाँ पे 7.4 के ऊपर जाओगे तो अल्कोलोसिस है, एंड व्हेन यू गो टू द लेफ्ट साइड इट वुड बी एसिडोसिस. सो दिस इज अ टूल दैट इज यूज्ड बाय नर्सेज टू इवैल्यूएट वेदर पेशेंट इज हैविंग एक्यूट or chronic respiratory acidosis and alkalosis respectively. But this is usually given in like Davenport diagram in physiology books also. So that's where the question came from. Answer to 45 is option number 46 is option number B. Okay. Next is about this kid. He came with difficulty in walking, and you can see the stork leg appearance of the legs. So movement says stork leg appearance, and you can also notice the contractures which are present. So stork leg appearance be contractures be, so diagnosis would be Charcot-Marie-Tooth disease. In Charcot-Marie-Tooth disease, the problem is with connexon 32. Connexon 32 is responsible for communication between the Schwann cells, क्योंकि जो Schwann cells होते हैं वो माइलिन बनाते हैं. तो अगर कनेक्शन 32 का डिफेक्ट होगा तो माइलिन की जो मतलब Schwann cells की क्रॉस टॉकिंग होती है वो लूज हो जाती है. You see, Schwann cells are responsible for production of myelin, and that will help in like insulation over the nerves and good conduction. So if connection 32 in the Schwann cells is missing, the Schwann cells are not able to function properly, and thereby the production of myelin will be less. If myelin is less in the patient, as a result of this, there would be like a demyelination. So this is a gap junction. Connection 32 क्या होता है, वो basically gap junctions का defect होता है. So the diagnosis of this patient is Charcot-Marie-Tooth disease, also called as hereditary. This is also called as hereditary sensory motor neuropathy. Charcot-Marie-Tooth disease and hereditary sensory motor neuropathy both mean the same. Answer to 47 is option number A. We go to 48. There was no diagram in that, but this is an infant who's brought with like hypotonia, weak crying, feeding difficulty, and delayed motor milestones. So floppy baby. And then there is like rod-shaped inclusions in the skeletal muscles with nemaline myopathy word given. Now he says which protein is like defective in this condition, which is responsible for the following manifestations. And titin to spring protein hota, so that is the one that is not involved in this case. The presentation is also not a dystrophin, because dystrophin is like much more later as a presentation. So either it will be nebulin defect or it would be leomodin defect. Let's have answer from yoga is like nemaline rod myopathy is the description that is given. And what is the protein that is defective in this case? So the protein which is defective in this case is gonna be, see, एक तो हम पढ़ते हैं nebulin. Nebulin is gonna be the red thing that is present over द एक्टिन पार्ट, इट विल बेसिकली स्टेबलाइज एंड कवर द एक्टिन पार्ट के जो मतलब एक्टिन के ऊपर जो स्टेबलाइजेशन के लिए पार्ट है उसको नेबुलिन बोलते हैं. बट देयर इज अनदर प्रोटीन विच इज ऑल्सो प्रेजेंट विच इज बाय द नेम ऑफ लियोमोडिन एंड द डिफेक्ट ऑफ दिस रिजल्ट्स इन नेमोलिन रॉड मायोपैथी. सो थोड़ा सा डिफिकल्ट था मतलब एज कम्पेयर टू, थोड़ा तो नहीं ये वाला तो ज़्यादा डिफिकल्ट था एज कम्पेयर टू चारकोट-मेरी-टूथ डिजीज. Answer to 48 is option number 8. Our question to question number 48 is option number C. क्योंकि एक्टिन वर्ड लिखा था तो दो ही पॉसिबिलिटीज होगी, या तो नेबुलिन होगा या ल्यूमोडेलिन होगा. क्योंकि आप डायग्राम भी देखते हो तो मतलब एक्टिन जो है उसके साथ में एक तो जैसे एक्टिन ब्राउन में दिखाया हुआ है, रेड पे जो दिखा हुआ है वो नेबुलिन है और साथ में ल्यूमोडिन है. सो इधर उधर टू वुड हैव बीन थॉट ऑफ. ओके, 48 is sorted. We come to 49. Nebulin in skeletal muscle functions primarily. तो फंक्शन मैंने इनडायरेक्टली बोल ही दिया था. व्हाट इज द फंक्शन ऑफ nebulin in the skeletal muscle? It is related to actin only. Yes, guys. Waiting for your answers for question number 49. It will help in regulating the activity of the actin. Actin क्या होता है? Thin filament होता है. So thick तो वैसे ही बाहर हो गया ना यार. Thick वाला तो बनेगा नहीं. Sarcolemma पे it's not a sarcolemmal protein. Sarcolemmal protein is gonna be like dystrophin. That's a sarcolemmal protein. Thick filament is gonna be myosin. So either it had to be actin or like nucleate actin filament assembly. Either of the two, right? Any of the two would be the answer. मतलब C versus D ही आपने select करना था. The correct answer to question number 49 is option number C. Regulate and stabilize thin filament length. Okay, so 49 is done. We come to 50. Pacemaker action potential is what is called as funny current. Funny current का नाम ही इस वजह से funny रखा गया because it starts in hyperpolarization phase. Answer to question number 50 is option number D. The reason why we call it funny current is primarily because it begins in the hyperpolarization phase.